Skin issues walk into the nail salon every single day, on hands, on feet, and sometimes on us. Today, we're going to be breaking down skin structure and some of the most common skin diseases and disorders that you're going to encounter as a nail technician. You need to know exactly when you can service them and when you need to refer them out, and how to protect yourself from overexposure and dermatitis. So let's get into everything you need to know about this topic right now. Hey guys, welcome back to my channel. If you are new here, what's up? Don't forget to hit the like and the subscribe button, and don't forget to hit that notification bell so you can be notified when I post new videos every single week. If you are new here, my name is Keisha. I am a licensed nail technician for more than 25 years. I am a New York State licensed teacher of the nail technology program. I am a content creator and I run my own business, and I post videos just like this every single week on this channel that is going to help educate you, show you tutorials, tips, tricks, and all of that. So if you like that type of stuff, and if you're watching this, I'm thinking you do, you might want to just make sure you hit that subscribe button and the like button so I can know and I can post more things like this. If this is the first time you are checking out one of my videos, you are coming into week 3 of a Nail Academy series that I am producing, where I am talking to you guys and giving you that education that you need, the same type of quality education that I gave my students in school to help you better understand the foundations of the nail technology program. Along with this video, in the description box below, don't forget to get your takeaway that is going to help elevate your education and help you understand this topic a little bit more. And this one is even more special because this is a heavy topic, and I say that where it's a lot of stuff to process when it comes to skin structure. So I've created for my students, it was basically a breakdown of the entire chapter and everything you need to know. So I'm going to upload that so you can have that information as well. So if you are watching this and you are in nail school, you're welcome. That's going to help you out so much when it comes to this chapter. So now let's get into skin structure, diseases, and disorders. So the first thing I always like to answer, which I know is a question that popped into your mind, is why does this matter to me? I am a nail technician. I'm touching nails, but we are surrounded by skin. The nail plate is surrounded by skin. We are performing and touching people all the time. So it's crucial that we need to know mainly always what we can and cannot work on. If you don't get anything from nail school, majority of the nail technology program is learning this information so you can know what you can do and what you can't do, what is normal versus abnormal. That is so important to us as nail technicians. So our main goal for this is to understand what we're looking at and why it behaves the way it does. So let's talk about skin structure and some of its main functions. So I just want to give a little brief disclaimer. If I mispronounce any one of these words, I'm going to do my best, but I am not an esthetician. I believe I have this pretty down pat, but just forgive me if I pronounce something incorrectly. So the first layer of the skin is called the epidermis. So this is the outer layer. It has no blood vessels in this layer. So within this layer, we have the stratum corneum. This is where the compacted dead cells, which is our barrier. This is going to be where your dryness, where callus, fissures all show up. Then we have the stratum lucidum layer. This is only on the palms and the soles, and this is going to add some type of toughness. Then we have the granulosum or the spinosum, and this is the living layer, where the melanocytes, where we have our pigmentation. The next layer is our dermis layer. So this is where collagen, elastin, nerves, blood, your sweat glands, where this is all the area where your pain, heat, cold, inflammation, all these things come from. And then we have that subcutaneous. This is our fatty layer for cushioning and insulation. So now let's talk a little bit about dermatitis, which is really, really big, and overexposure for nail technicians in the nail salon. This is a super important topic. If you take nothing from this video, dermatitis is the biggest thing when it comes to nail technicians and overexposing yourself to all the different types of chemicals that we are involved in. So we have two main types of dermatitis that you are prone to. So the first one is going to be irritant contact dermatitis. This is when we are working with wet solvents, acetone, and all these stuff, dust, all these things. And then we have allergic contact dermatitis. This is when your immune system has a reaction to a specific product. So like your monomers, your acrylates, all these things, cyanoacrylates, resins, fragrances, all these things when you get allergic reaction. And that usually stems from overexposure. So we as nail technicians work with all these things all the time. So we're prone for overexposure for basically everything that we touch. Remember, chemicals reside everywhere. It's in our filings from dust. It's on the bottles. It's on handles. It's on all these things. And overuse and overexposure to these chemicals can actually cause you to have allergic reaction and hence allergic contact dermatitis. As well as your clients, some people will sit and question, I used to get my nails done all the time. Now all of a sudden I have allergic reaction. I used to do gel manicures all the time. And now I break out because possibly, well, not possibly, they are allergic to this product now. Maybe there's an ingredient in certain products or the product itself or the overall main chemical. It's something that they became allergic to over time from overexposure. Now they were overexposed because the technician probably allowed that product to get onto their skin or put the product on the wrong way. It seeped through the nail plate into the nail bed. It affected the matrix. It's an ongoing thing. You can see I can go on and on and on about this. This is just a really, really important thing to make sure that we are using good products. We are applying it the right way. We are not overexposing ourselves. We are not overexposing our clients, because this is a super important thing that can end your career if not taken seriously. So some symptoms that you might notice in yourself if you become allergic or you have an irritant contact dermatitis would be red patches on the webs of our fingers. We're more prone to it. We tend to touch our faces a lot. If I go like this for my glasses, we have elbows that are sitting onto the table, which could be exposed to the particles of dust, blisters, cracks. Sometimes your eyelid in your face will have irritations. All of these things are going to be signs that something's going on. I know I had some girls go through some dermatitis reactions in nail school in working with the odorless monomer, and everything was fine. I had 2 cases of allergic contact dermatitis. The first girl, it showed up, I mean, we were not months, but we were a couple weeks into nail school, and she's like, Miss Keisha, I'm breaking out. She started to get little blisters on the back of her fingers, and it was kind of like cracking. You could see that it was very dry and everything. And I'm like, do you wear gloves? She's like, I wear gloves. I wash my hands every time before and after I take off my gloves, blah, blah, blah. What we discovered was when she was filing, she removed her gloves, and the dust particles from the odorless monomer. Again, if you've worked with odorless monomer, you know when you file off that inhibition layer, it can leave little chunks as opposed to just small debris. And holding the mannequin's finger with those nail filings caused her to actually break out. The second situation was kind of the same, but I don't think she was wearing gloves, and she had a really, really, really bad flare-up and reaction and had to go to the doctor. I mean, she had like things wrapped around her fingers. She had to go to a dermatologist to kind of hear herself, and she couldn't, practice for about a week because she was just in so much pain. So you want to take it seriously, and if you notice anything, stop immediately, go to a dermatologist and get yourself checked out and just confirm what's going on so they can treat you. So it's important to remember that overexposure is going to be from how much of something you're using, the frequency, and the time. These are things that are going to equal overexposure. And we're just prone to overexposure just because this is just what we do. So it's inevitable. You were being overexposed, but how we handle certain things and the protocols, that's going to play a large part of if I'm going to have a reaction or not. And remember that even using products repeatedly that are safe to use on the skin or were inhaled as such things as like fine dust, we can still have a reaction. So a couple things I want to point out on how we can prevent dermatitis, either irritant contact dermatitis or allergic contact dermatitis. So the first thing is we want to make sure that we have no skin contact with uncured products. So even if you are wiping drips immediately, never wipe onto the skin. We want to make sure that we are using gloves when we're touching these things, and we are not touching anything that is uncured. If you are somebody that likes to do those little 3D flowers, we have the little molding stuff right now, wear gloves when it comes to this. If you have a hole in your gloves or you feel that your gloves are too thin, we don't really want to be cheap in certain things because, again, that's your health. So we want to make sure that we are protecting ourselves. So making sure that you're wearing gloves if you're touching anything. Because remember, that 3D molding gel, it's gel. It's uncured gel until we sculpt it and shape it into the little flower and we cure it. It is uncured product. Next thing is we want to make sure that we are correctly curing everything. Don't assume the cure time for your product. If you are using a new product for the first time, take a glance at what the recommended cure time is for your product. Don't assume it's 1 minute, because this one product might have an ingredient where the manufacturer decided this needs 90 seconds, not 60. Don't assume. Make sure that we are matching the cure time for what the manufacturer recommends. Because undercuring product is going to definitely not hurt you, it's going to hurt your client more, because that uncured product is going to seep down into the nail plate, into the nail bed, and it's going to affect their clients. These are chemicals that are uncured. And I say this so much, but especially working with gels, gels are so tricky and slick because they love to look cured, but inside we have molecules going around that are uncured that seep down and can hurt your client. Gloves. Wear gloves all the time. Wear gloves for your filing. Wear gloves for your application process. We want to make sure that we are using nitrile gloves, not latex, because they are going to be your first line of defense against any type of product monomers. If the gloves get contaminated, you want to make sure that you are changing those gloves out immediately. Your ventilation and dust control, making sure that you are ventilating, you're wearing your mask, you have your dust collector on, and it is having the proper filter. I mean, I could be guilty of that too. Sometimes I'm a little cheap and I don't want to replace my filter, but we have to make swe that we are replacing the filter, because what is the point of having a dust collector if you have a dirty filter that's not filtering out the dust and the chemicals? We got to make it make sense, you know? Handling your products, handle with care, making sure that all the bottles are wiped down. If we are touching stuff, you should really be wearing gloves throughout the whole entire process of touching polished bottles, changing out polished bottles that are just disgusting, wiping them down, taking these slow moments during the work week to clean up these things. And your skincare. How do you take care of your skincare? Remember, guys, that barrier creams, skin creams, actually create a barrier that is going to protect the layers of the skin from things getting into it, if you didn't know. There's a difference between creams and lotion. So they are barrier creams that you can use, that after you are washing your hands, you are making sure that you are putting on that barrier cream. Now, that doesn't replace the use of gloves, but we're adding an extra layer of protection for our skin by doing this. And lastly, if you are somebody that you found yourself to be allergic to, or maybe just, I don't know, sometimes people are just very interested in from the manufacturer's point of view, the SCS or safety data sheets, knowing what is in your products. If you are trying to avoid something, you're trying to avoid MMA, you're trying to avoid HEMA products or highly use of this chemical or this ingredient, look up the SCS sheets. I've done a video about this previously on what that means. You can easily Google a product's SCS sheets. If you cannot find it online, you can email them and ask them for their SCS sheets. You should be aware of the chemicals that you're using in your space and on your clients, and what the manufacturer tells you on how to store them, how to get rid of them, and how to handle if something were to happen. So now let's get into skin lesions, disorders, and diseases that are important to know as a nail technician. And I just want to point out that as a nail technician, we are only really concerned with primary and secondary lesions. So let's get into all those details right now. So primary lesions, so these are going to be the initial changes in the skin. There are a lot of them. We're going to run through this, but again, if you want more detail on this, definitely get your handout that I've included in the description box below. So the first one is going to be a macule. So this is a flat discoloration, aka freckles, flat mold. There's no texture change to the skin. Then we have a papule. This is going to be a small raised bump. So example would be a wart or a pimple that does not have pus in it. A vessel, which is a small fluid-filled blister. So an example is going to be like a cold sore or chicken pox. A pustule, this is going to be an elevated lesion that does contain pus. So this could be an acne papule. So if you have a pimple that has pus, then that's what this would be defined as. A nodule or tumor. This is a large solid lump. So something like a cyst or any type of benign growth. A wheal, which is a itchy raised area that is usually caused from some type of allergic reaction. So an example would be hives. And plaque, which is a flat-topped raised lesion. So an example would be a patch that you would get from psoriasis. So next we have these secondary lesions. So these result from some type of progression, scratching, or healing. The first one is crust. So this is dried sebum, blood, or pus. So an example would be a scab. A scale, which is flakes of dead skin. An example would be psoriasis or dandruff. A fissure, which is when you have cracks that go into the dermis layer of the skin. An example of this would be a deep heel crack. If you've ever done someone's pedicure, maybe you've experienced this yourself and you see I'm scrubbing, and it still looks cracked. That is because now the problem is not superficial, but she has cracked layers into the skin, into that dermis layer. So now she needs something probably medicated or prescribed to heal that crack. Then we have an erosion, which is a shallow loss of skin surface. So this is usually after a blister has been popped. This is an ulcer, which is a deep open sore, usually a scar. Excoriation, which is a scratch or mark or any type of abrasion, usually from itching. A scar, this is when the fibrous tissue is going to replace the normal skin. And lastly, we have a keloid, which is overgrowth of the scar tissue, which is raised and thickened, and there's levels to keloids as well. So next we have some disorders of the sweat gland, which are important to learn because sometimes we experience people's reaction to touch, or we notice things in their skin that during a service that we don't really understand. So this is where this kind of helps you get a better understanding of what could be going on with your client's skin. First, we have anhidrosis, which is a lack of sweat production, and this could actually cause overheating. Then we have hyperhidrosis. So this is an excessive sweating of hands and the feet is common. You may notice this in some type of clients where they constantly have moist hands. A way to kind of avoid that, I always find that people that have this disorder, they usually are aware, and you'll kind of like low-key notice them every time you switch hands. They wipe their hands and they'll know. I found that having my dust collector up a little higher because it's blowing air over it, that has helped. If you are funny with touching someone and their hands are very sweaty and everything, you can wear gloves for those clients as well. I find that that helps because sometimes it could be a little, so these are just things that we have to deal with, but ways to avoid it as well. Then we have bronchidrosis. So this is foul smelling sweat. This is often going to be found into the feet, and it's caused by bacteria breaking down the sweat. And lastly, we have malaria or prickly heat. Sweat that is trapped in the ducts, and it looks like small red vessels or like an itchy rash. So there are some skin inflammations that we had previously spoke about. So let's just go into a couple of them again so we are better familiar with them. The first one we have is dermatitis or eczema, which we previously spoke about, which is inflammation, redness, itching, scaling, and it can be a chronic issue. Then we have the contact dermatitis, which is going to be your irritation or your allergic reaction to product overexposure, important for nail techs. Then we have psoriasis. This is a chronic non-infectious disorder with, it looks like silvery scales and thick plaques, and it also may affect the nails. If you've seen that video where I've done, you can have psoriasis on your nail plates as well. So let's jump into some infectious skin disorders as we would see them in the nail salon. So the first one is going to be bacterial infection. So impetigo, this is contagious, honey-colored crust. We do not want to service clients with this. Cellulitis, red, swelling, spreading infection. This is an urgent referral for your clients. If they don't know it, please inform them. They need to seek medical attention immediately. Then we have some viral infections. So warts, HPV, rough growths. These are very contagious. We do not work on them in the salon. Herpes simplex, this is painful blister clusters on the fingers. This is also highly contagious and we do not service these clients. Then we have some fungal infections that we don't want to deal with as well. Tinea pedis, this is athlete's foot. So if you notice peeling, itching between the toes or on the soles of the feet, please refer your client. If you've already started the pedicure, just make sure that you are cleaning and disinfecting everything that you use. If it can be thrown out, toss it, because you will pass it on to your other clients. Then we have a parasitic infection, scabies, which is mite burrows causing intense nighttime itching. This is again very contagious and we do not service these clients. And we always want to remember to look, recognize, and refer your clients. It's very important. Again, the takeaway from this video is to just recognize what we cannot work on, when we need to modify, and when we need to refer someone to seek professional help from a medical professional. We are never allowed, never, ever, 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 ever allowed to diagnose and say to someone, you have this, this, and that. You can say, this looks like it might be, keyword is might be, could be, so-and-so. I'm identifying what it could be, but I'm not telling them, you have this, use this. We are never allowed to do that. So be mindful of your vocabulary and your wording when or if you notice something in one of your clients. Hopefully this video was able to help you understand the skin structure diseases and disorders of the skin, so you can again be able to identify what you can and cannot work on. If you like this video, do not forget to give it a thumbs up and stay tuned next week, where we're going to be concluding Nail Academy with the last video touching on a foundational topic that I bet you can't guess. If you can guess, leave me a comment down below. But it's something that I debated on doing, but I'm like, it's low-key important, but we're going to throw it in there at the end. So make sure that you are locked in and subscribed so you don't miss that. Thank you so much for watching, and I'll see you next time. Bye.